All right, we're going to go ahead and get started. We would like to welcome you to today's webinar on connecting communities of care via health information exchange. This webinar is part of the monthly North Carolina AHEC Practice Support Services Lunch and Learn webinar series. A quick reminder for everyone to please mute themselves. There will be designated times during and after today's webinar for questions and comments. For now, we will hand it off to Jessica Brimmer.
Thank you, Danielle. Thank you everyone for those who have joined today's webinar. My name is Jessica Brimmer. I'm on the Business Development Outreach team for the Health Information Exchange Authority. And I know we only have a short period of time today, so I'm gonna go ahead and jump right in and give you guys an overview of what we will be speaking about. So I will provide an overview of the HIE mandate and when providers are required to connect to the Health Information Exchange. I'm also going to talk about exchange services, notification services, and also the controlled substance reporting system or the prescribing service that we have within our clinical portal. And that's really just to alleviate the burden of providers or healthcare members such as yourself logging into multiple systems. And then we're going to talk about some provider use cases around NC Notify, which is our notification service, and then of course any questions at the end. So let's go ahead and get started with exactly what does the law mandate. So I'm going to walk you through this timeline, and as you can see, June 1 of 2018 was the first deadline. And this deadline was unique in that it was for Medicaid providers that had technology. So you can see if you fell under the hospitals, physicians, physician assistants, or nurse practitioner list, then you would have to connect by that June 1 of 2018 deadline. And then we move to 2019. This is where the prepaid health plans must have connected to us by the start of their capitated contracts. And so we are actively engaged with all 5 prepaid health plans. And then we move to June 1 of 2020, which you see that has been marked through, and we have October 1, 2021. And so just because of COVID and some other changes, there was a change in the law that stated that these individuals shown on the screen, so you've got your Medicaid providers, as well as providers who receive other state funds, such as the state health plan, with or without technology. So those providers have to connect by that October 1, 2021 deadline, unless called out in the June 1, 2021 deadline. So you can see that June 1, 2021, dentist, ambulatory surgical centers, psychiatrists, state labs, pharmacies, and then other state healthcare facilities. So who we are at the Health Information Exchange Authority. So we are the state designated Health Information Exchange. You may hear the term the Health Information Exchange Authority or NC Health Connects. So NC Health Connects is really just the tool. So when you're logging on to our clinical portal, you're logging on to NC Health Connects. And the authority is just the body of people who really educate providers on the law. We are a secure network, and that allows providers to safely and secure patient health information just through a trusted network. And this is really to improve healthcare quality and outcomes for North Carolinians. We also have a public-private partnership with SAS Institute, so they are our technical partners. So at any point in time, if you have questions about your connection, or you may be in contact with someone at SAS, but if you have additional questions, you can always reach out to us at the Health Information Exchange Authority, and if we do not have the answer to that question, we will be more than happy to facilitate a call with SAS. So NC Health Connects by the numbers. We have over 55,000 providers that are sending records to the Health Information Exchange, 6,000 plus healthcare facilities that are live and submitting data, including 118 hospitals. 5,000 are in the onboarding process, and really what that means is that those providers or organizations have signed a participation agreement, and they're just waiting for that connection to be built from their EHR over to NC Health Connects. We have 100 million plus continuity of care documents, or CCDs, and included within that we have 9 million unique patient records. We are engaged with over 225 EHR vendors, with 80 of those live in production. And then we are connected to 20 border and interstate HIEs, and that's done via the eHealth Exchange, as well as the Patient-Centered Data Home. And so we're going to talk about that a little more in this presentation. So the next thing is expanding exchange reach and capabilities. So there are different ways to access a patient's clinical record. So one would be through the clinical portal, and that's by a unidirectional connection. And then another would be an EHR integration. So that means that if you're sending information to us, because you have to, based upon the law, then we can use that same data feed and we can send information back into your EHR. And so that's what we call a bidirectional connection. The next thing is direct secure message. So I know some EHR vendors, they do offer DSM addresses to their customers, but we also offer DSM addresses, and this is how you can communicate with other providers in North Carolina about patients securely. So say if you wanted to attach some type of document to your message, you would be able to do that within our clinical portal. So if your EHR vendor does not provide that, or you do not take advantage of that service, you can absolutely take advantage of that service via NC Health Connects. Also public health reporting, so ELR for hospital systems as well as health departments. So because those systems are performing electronic labs, that information is sent over to NC Health Connects, and then we can of course send it on to other state departments on a participant's behalf. And then we get to NCIR, so that's the immunization registry. I have a couple of more slides at the end of this presentation regarding NCIR, so I will save that for a couple of slides later. And then we also are going to speak on the controlled substance reporting system and exactly what that looks like within our clinical portal. So we really just want providers to be able to work within NC Health Connects without having to leave that system. And so I'm going to give you a screenshot and walk you through what CSRS looks like within our clinical portal. The next thing is the neighboring connections via the eHealth Exchange. So we are connected to the eHealth Exchange, and what that means is when you log on to our clinical portal and you're searching for a patient, on the back end, we are calling these states and we're saying, hey, do you know this patient? And if yes, provide me documents on that patient. So on the back end, that's happening. So we get those documents, and then we're able to populate that within the clinical portal for you. So you can see here that we do that with Tennessee, Georgia, Virginia, South Carolina, Coastal Connect, which is a HIE in Wilmington, the Veterans Administration, as well as the Department of Defense. And then we do have integrations planned, the OBOT project, and then of course, NC Care 360 for the social determinants of health. So moving right along, the first service that I want to speak about is NC Notify. And so this is our event notification service. So I'm going to walk you through this diagram on the screen. And if any of you have already enrolled into NC Notify, you may have already seen this diagram. But we're going to start with Ernie. So Ernie is at home and something happens to Ernie. Maybe he falls and he thinks he has broken his hip. But he's also having chest pain. So Ernie goes to the hospital. Ernie ends up getting x-rays and other tests, maybe even an EKG. Because that encounter happened and that hospital is connected to the health information exchange, we are going to be aware of that encounter. So NC Health Connects has sent that information. If a provider is enrolled into NC Notify and they are monitoring Ernie's health, then we are able to send that encounter information over to the provider that is monitoring Ernie. And then at that point, you can then follow up with Ernie and maybe bring him back in for a visit within your practice. And so maybe there needs to be a change in medication, or maybe there needs to be some type of referral. So you would be able to do that, and you would be alerted when and where Ernie showed up at a healthcare facility. So on the patient panel, and in the next slide, I'm going to talk about different ways that you can send a patient panel, and then we're going to talk about how you can receive the patient panel. So we need to know who you want to monitor as for your patient population. So you're going to be able to create a patient panel in different ways, but in the patient panel, we need to know the things on the left-hand side of the screen. So of course, we need to know your organization, the patient ID, and the patient himself or herself, as well as the demographic information. And I also want to point out there are custom fields that you can put on your patient panel. So for instance, if there's something that you do not see on the right-hand side of the screen that you would like to see, you can always create that custom field sending over to us. And then we, of course, will always send that custom field back to you. So now I'm going to jump to the right-hand side of the screen. This is the information that you are going to get back. So if you are monitoring Ernie, you're going to send us information on Ernie. We're going to scan our system to see if Ernie has had a healthcare encounter, and then we're going to provide that notification back to you. And those are the data elements listed on the right-hand side of the screen that you will be notified on. So current metrics for NC Notify, we have 1.4 million patients being monitored currently. 61 participants, and that's at the organization level. And so the way that we work at NC Health Connects is the organization could be like a larger healthcare system, but then there are participating entities or locations underneath that. So we have 61 participants or organizations that are enrolled into NC Notify. We have currently generated close to 300,000 alerts. Most participants are receiving daily files, and most have opted for real-time notifications. So when we first implemented NC Notify, we had participants that were receiving weekly files, some were receiving quarterly files, some were receiving batch daily files, but we now have the ability to send you near real-time notifications, and most of the providers and participants want that information. And then on the other side of that, most participants, they are updating their panels weekly. So they, of course, want us to know that I saw a new patient yesterday, so I'm going to go ahead and add that patient to my patient panel. So then I would be notified if that patient left my facility, showed up at another facility, and then I could also follow up with that patient. All right, so I mentioned that I would talk about how you could send the patient panel and then how you could receive the patient panel. So sending the patient panel, there's 3 different ways that you can do that. Number 1 is what we call the recommended option, and this is the auto subscription. So what this means is that if you are connected and sending data to NC Health Connects, and because you're doing this to meet the mandate, we can then take that information, and so say you saw 50 patients today. We can take those 50 patients and we can build a patient panel for you. So then the next day you see another 50 patients. We will then take those 50 and add to the previous 50. So you can kind of see how that will work with auto subscription. Number 2 is the NC Notify standard patient panel. And this can be delivered to us via an SFTP or direct secure message. And then we also have that custom patient panel with those custom fields. And that can also be delivered to us via SFTP or direct secure message. And then we go into the results. So this is how you want to receive the notification back. So you want to know when Ernie showed up at a healthcare facility. So you can do this by logging into NC Health Connects, the clinical portal, and we have a section for NC Notify, and you will be able to see the dashboard. And within that, it's going to say, yes, Ernie showed up at this hospital, and here's why Ernie showed up at this hospital. Number 2 would be receiving the notification result file, either SFTP or direct secure message, and this is going to be like a flat file, so it's more like of an Excel spreadsheet. And then number 3 is going to be receiving those notifications as HL7 ADT messages. So that's going to be your near real time, and that can be done VPN, or it can be bundled together, and you can do that SFTP or direct secure message. I know some of this sounds like technical talk, but we will be more than happy to walk you through this when you actually fill out the enrollment form and we have that technical discussion and walk you through these options. So what does this look like within the clinical portal? So you can see on this screen here, this is a version of our NC Notify dashboard. All of these patients that you're seeing on the screen are not real, so no worries about HIPAA there. But on the left-hand side of the dashboard, so if you see right here, these are going to be your notifications. And then on the right, you can see the demographic information and the most recent event that occurred. I want to point out at the very top, you do have the ability to add customized filters. And so what that means is if you want to know all of your patients that have either presented with a COVID symptom or maybe have had a positive COVID test, you would be able to do that here. I know a provider recently asked me, I want to know if a patient had presented back in the ER within the last 30 days or had been admitted into the hospital within the last 30 days. You would also be able to do that here. So different filters that you guys can choose from, and this is within our clinical portal. So a couple of use cases. We have one from a behavioral health agency. And so it really just says the emergency ADT feed from NC Notify that the provider reviewed was timely. And when the provider went into NC Health Connects to pull the CCD, she was able to get some valuable information regarding the physical condition of the patient or the client, which could then be shared with the direct care staff in the program. And that was really because the guardian failed to let them know when the child had been dropped off for treatment. And then you can see on the right-hand side, FQHC mentioned that with services like NC Notify, the entire care team can have much needed information to keep patients safe during the riskiest of times. And then we also have a large hospital system utilizing NC Notify to gain insights into other facilities in their system that are not in the same EHR. And so you can see, of course, that will affect downstream care management dashboards. And so we've tried to make it very easy for you guys with NC Notify. I know it says there's 6 steps here, but the 6th step is just really welcome aboard. So the only thing you really have to do is fill out that enrollment form. So there's an enrollment or migration process. And then we have an onboarding call with you. And then, of course, if there are any other forms or documentation, we will let you know at that time. And then there's the technical prep. And then on our side, we will do the patient panel validation and testing. So you will just need to let us know how you want to move forward with enrolling into NC Notify, how you want to send and receive those patient panels. And like I mentioned, we are here with you the entire step of the way. So no worries at all if this sounds a little confusing, because we are definitely here to help. So the patient-centered data home, and I have a couple of more slides to get through with maybe 10 or so minutes because I want to make sure we have time for questions. So the way that patient-centered data home works is that this is a push of notification based on the patient's zip code. So say Ernie was visiting his friends in Colorado, he was snowboarding or skiing, he also has another fall. He ends up going to the hospital there because that hospital is connected to the Colorado HIE. Then that HIE is going to send that information over to North Carolina because it says, oh, Ernie has a zip code and his home zip code is in North Carolina. So it sends that information over to the North Carolina HIE, and then in return, we can then send that information over to the home care team for Ernie. So the next slide here just shows you, I like to call this the data highway or the data health highway. So you see all these different points where the HIEs are connected to this main data highway, and that's how the information is being pushed to the home HIE of the patient based upon the zip code. We are now moving into the controlled substance reporting system. And so this helps providers meet the STOP Act requirement. So it's really for those providers who are prescribing controlled substances, and they have to go into the APRIS, or the controlled substance reporting system, to pull a report on the history of that patient. And so, like I said before, we want to make sure that providers or healthcare staff members are able to work within NC Health Connects and really not leave NC Health Connects for their needs. So you can see in the very next slide, this is without even being in a patient record. You have a button at the very top of the screen that says CSRS report. You do have to enroll into this service. So if you have enrolled, you will see access granted. And this is for providers who are prescribers. So if you're not a prescriber, you cannot actually enroll into CSRS. But if you have access granted, you will put in the demographic information there. It will pull up the report. And then on the right-hand side, you will see access denied. And that just means that you do not have access. But if you need access, have your participant account administrator at your organization reach out to us. Now, if you are already within a patient record, that means you've already filled out the demographic information, and you can see the tabs on the left-hand side of the screen. At the very bottom, it says CSRS report. And so you can see on the left, it says access denied. On the right, it'll say access granted. So it shows you a little bit different of a screen than what you saw on the previous slide, but you will have to check the checkbox here, and then you will then click CSRS report, and that report will pull up for you. And on the back end is going to check the box that you met the STOP Act requirement. So there's no need to leave NC Health Connects or get out of your EHR to then log into the APRIS or CSR system, because it can all be done here for you. All right, couple more slides before I open it up for question. NCIR, we know that physicians or nurses are having to log immunizations into the NCIR portal, but they also then have to log it into their EHR. So we can see here, logging into the NCIR portal, also logging into the EMR. Well, what we have done is we have built an integration where, because you are logging that information into your EHR and you're sending it over to us to be in compliance with the mandate, we can then take that information and we can send that to NCIR on your behalf. Now, this does require a bi-directional connection, so you would have to make sure that your EHR does have that capability. So just remember that bi-directional connection is needed, but it does help providers and the healthcare staff members. And it really just cuts down on the time that you're spending to enter that information into two different places. The last thing that I would like to talk about is laboratory results. A lot of providers have asked, they want to see those labs, especially during the times that we're living, who has had a test, who came back with a positive test. And so we are onboarding commercial labs, Quest and LabCorp, to NC Health Connects. But there is a step that has to be done for us to receive all patient data from those labs. And so there is a form. It only applies to full participants. And that form is located on our website. And you can also reach out to us at the email address at the end of the slide deck for the form. And let me just show you what that form looks like. This is the lab form. And so you'll put the name of the entity, so of your organization, and you will need to either say yes or no to Quest and LabCorp. And then, of course, if there are any other labs that you guys are working with where you would like them to send us all of your patient data, so that then we're able to provide that information out to providers who have a treatment relationship with that patient, then you would need to list that within this section here. And then, of course, on any legal document, we will request a signature and name, title, and then date. And then I have about 5 minutes for any questions that anyone may have. And then, of course, you can go to our website here. There's also the email address. And then If you have a question directly related to this presentation where you maybe didn't get a chance to ask it today, if you'll send an email to the email address on the screen, then it will be routed to me. So any questions? I know that was a lot of information to take in within 30 minutes.